Hello and welcome to a special episode of Vaccinate India in partnership with Google. Now this is a program that's very close to all of us, both here in NDTV and at Google. And the message is very clear. We're looking at the importance of vaccinating, of urging people to get out there and vaccinate as soon as possible. Today we're going to demonstrate to you how very easy information on where you can vaccinate is available right here on your smartphone. Also testing centers should that be necessary. But we'll also be looking on this program at some of the trends that we are seeing in the United Kingdom and the decision of the government to actually open up. What are the potential consequences of that with spiraling cases? But first, let's give you a few details of the ease with which Google enables you to actually get a lot of important information on vaccinations and testing facilities. So just on Google Maps, all you need to do is click latest in the area and you get COVID-19 information and vaccine locations. So again, just click over there and these are all of the areas where COVID-19 facilities are actually available to me. So it's identified various hospitals. So Summer Hospital, SCI International. Again, all I need to do is click on this and it gives me photographs over here, very easy to understand. It also gives me important information. For example, today as we're recording the segment, it's Eid al-Adha might affect these hours when that takes place. It's got a rating which has been given as well. And it's got reviews by people also. So you can review it as well if you go over there. So it gives you that sort of detail. But there's other important detail which you can actually get on this as well. You just need to scroll back and it gives you a couple of other interesting options about COVID-19 information. So just by way of knowing where you can test, click on COVID-19 testing or coronavirus testing, and a list of labs actually comes over here as well. So these are a couple of important points that you can actually get as far as all of these centers. And you just have to see what your location here is and then click the one closest to you. Should you choose to go over there, you have the option of directions as well. And as you can see, the closest center is just 5 minutes away from me. You can click on start and you can actually go to that location. So it's actually very easy for you, testing centers and centers where you can actually get vaccinated. So those are a couple of important ways that you can actually go ahead and vaccinate. So that's what the message of this program is. Vaccinate, test if you need to. This is all very important to protect yourself, to protect your family and your friends. Remember, India's goal is to vaccinate the entire adult population by the end of the year. Now that's dependent on two factors. Firstly, the availability of the vaccines themselves, and secondly, the administration of vaccines. On a daily basis, India is falling short of that target because we're just not vaccinating enough people. And that's because of a host of factors. But the longer it takes, there are problems. And the problems are associated with the fact that we're going to have our masks on for longer. And secondly, and most worryingly, the pace at which a potential third wave being upon us actually goes down. It could be upon us much, much sooner. So that's a worry. So let's give you some data points to tell you where we are in terms of doses of people who have been vaccinated and where we ideally need to be. Over 51 lakh doses were given on the 24th of July. The 7-day average of this is about 39 lakhs. Now that needs to be up substantially so that India is in a position where the adult population is fully vaccinated with 2 doses by the end of December. But this really is key. India's vaccination requirement, the daily number of vaccine doses, is 9.3 million doses a day. That is to ensure that 60%, which is the target of all adults, are fully vaccinated by the end of December. Now the actual number in the last 7 days, 3.9 million, and therefore the daily shortfall is at 5.5 million doses. The actual vaccination today, 4.3 million, and therefore the shortfall is 5.1 million. The decision of the United Kingdom to open up is an international headline. After having gone through a huge wave in the past, one would have thought, or many would have thought, that the United Kingdom would perhaps be more cautious in its approach to dealing with new mutations. They are dealing with the Delta variant. This is the same variant that caused so much havoc here in India. But the philosophy of the government in the United Kingdom is different. They've in fact decided to go ahead and open up. The implications of this are possibly difficult to understand, but certainly give an indicator of a willingness of trying to see how effective the vaccines are, in the belief that the vaccines alone will ensure a level of protection which will ensure that a large number of people who have been double vaxxed in the case of the United Kingdom are relatively safe. Joining us now for their views on this strategy, the implications, the soaring numbers at this stage, how long this could actually go on, Professor Polly Roy, Professor of Virology at the London School of Hygiene and Tropical Medicine, Dr. Rajai Narayan, the Director of the Global Health Alliance of the United Kingdom and a Senior Cardiologist, Professor Sanjeev Krishna, Professor of Molecular Parasitology and Medicine at St. George's University, London. Let me come to you first, Dr. Narayan. The policy of the United Kingdom at this stage is to open up. Do you believe that's based on sound medical advice?
Thank you, Vishnu, for having me on the show. As you know that the government follows the advice of the scientists and the experts that they advise on various health issues, and that is why the government has decided to open up since yesterday. As you know that there are no restrictions anymore, so people are not wearing masks, there's no social distancing, everything has opened up. But we also need to realize that the economy has to open up like any part of the world. But as you know that the number of cases in the UK are going up. They've got about 50,000 positive cases now on a daily basis, up to 50 deaths, but the number of admissions are very less because we have now vaccinated almost 88% of the population with the first dose, 68% with the second dose, and that gives a huge amount of protection against the COVID. None of the vaccines, as you know, that they are 100% effective. They are only about 60, 70, 80% effective in the real world scenario. But I think the government is also in a difficult situation that they have to try and open up. They have to open up the economy because people are suffering. There is lots of joblessness, the economy is suffering, the finances of the companies are suffering. So some kind of, obviously this is a big gamble that the government has taken, but this is as per the advice from the scientists, chief scientists who advise the government.
Professor Roy, is there a sense that if you open up in the manner in which things have opened up in the United Kingdom and are continuing to do so, there could be a breeding ground for more mutants of COVID?
Not probably true so much because most people are vaccinated, 3/4 of population are vaccinated. And virus will not amplify very high amount on those people even they get infected. Very rarely they will get infected. If they get infected, virus will not amplify much. If virus cannot amplify, they cannot mutate. They cannot make the mutation either. So most likely we are very safe. Most likely because we are vaccinated twice, particularly the people who are vaccinated twice, they will not get infection and very low level virus load. So we will not create the variant. The problem will be the people who are not vaccinated. If they get infected with the COVID now, they may make the virus more variant in their body because more they amplify or make the copy, more they make the error. Error means they will make the variant.
Okay.
That is the possibility, but very low number still.
Yeah. Professor Sanjeev Krishna, how far, what are some of the trends that you're seeing and how far is this expected to go on in the United Kingdom before it starts plateauing out?
Right. Well, thank you for having me as well, Vishnu. It's very hard at this stage to predict trends because small changes at this stage will have large impacts later. But I have to disagree with some of the comments that have come before me. I think that what we're seeing here is not so much advice of scientists and physicians feeding into politics, but politics impacting on how the virus is playing out. There is no other country in the world that would open up in this way despite the vaccinations, when cases are climbing as quickly as they are. And this will have population impacts. It will increase mortality. And there is a false dichotomy between opening the economy and then having mitigation measures, because you can have mitigation measures and have the economy open in the context of quite a vaccinated population. So I think the narrative needs to change from what politicians are saying to really a much more evidence-based approach to managing things.
Professor Roy, is it also not true that because the United Kingdom has had a relatively high number of double vaccinations done compared to many other countries, certainly India, that there is still a large percentage of people who are being hospitalized who have actually been double vaccinated? And that is just proof of the fact that the vaccine can possibly save your life, but it doesn't necessarily save you from hospitalization.
Well, it all depends on the level of antibody. Some people have preconditions, underlying conditions that will not make them, allow them to make large amount of antibody. And then some of these vaccines, particularly AstraZeneca's vaccines, doesn't really give high amount of antibody either. But nevertheless, all these vaccines, AstraZeneca's or Pfizer's or Moderna in America particularly very good, gives a high, enough sufficient antibody that will allow the protection from the severe disease. And for normal healthy people, definitely so. So, but immunocompromised people will have a problem.
Yeah.
But as I agree with all of you, but you'll have to have sometimes functional life as well. We cannot be all the time locked down and do nothing. But of course, we have to open up a little bit cautiously.
Right. So, and that point's so important that people need to be careful. In fact, Professor Krishna, let me ask you this. What we saw over here during the Euro Championship and Wimbledon, thousands of people in stadia, we saw one of our own cricketers, Rishabh Pant, contract COVID. Now no one knows, of course, where he got it, but he was maskless at Wembley. It just seems bizarre given all the science around. There has been no dearth of science coming from the United Kingdom. So is there any sense that herd immunity is the way forward in terms of dealing with this?
This is such an important point. Herd immunity can be achieved in a variety of ways. One of them is vaccinations, and we've heard that vaccines are not perfect, and we've heard that some vaccines are better than others. For example, the mRNA vaccines are better than some of the others. And this must be rolled out as effectively as possible. But this leaves a large number of vulnerable people. Polly has mentioned one or two of them, but there are 4 million or so people who are in categories that should be shielded. And as a society, we must take this into account. And what the policy that the government seems to be pursuing in this country is, let's let the infection take off, and those that haven't been vaccinated or those that aren't fully protected, let them then develop a natural immunity. But they are not talking about the human cost. They're not talking about the cost to the NHS. They're not talking about long COVID. And they're not talking about the fact that if you are isolating on test and trace with a very high number of infections, that is going to affect the economy because there won't be the workers. Yeah. There'll be a shortage of key workers. Finally, there is a selection of mutants in partially vaccinated individuals. And if you wanted to select variants, you'd have a large number of infections and partially vaccinated population. Look what we've got.
Dr. Narayan, in terms of symptoms of people who are being hospitalized, are the symptoms absolutely identical to what we've seen in India? A lot of breathing distress, a lot of need for high flow oxygen, those with comorbidities particularly vulnerable. That there is a certain danger of overuse of steroids, which is often prescribed very early. That's been a learning experience here in India. Is that what you're also seeing in the United Kingdom in terms of symptoms?
Yes, Vishnu, one good thing about UK practice is that we do the same practice throughout the UK as per the NICE guidelines. So no one gets steroid in the community, unless you come to the hospital with an oxygen saturation of less than 94%. You are never given steroid like in India. Because I've got lots of friends, doctors, colleagues that I've been speaking to in India, and I know people are giving steroid left, right, and center the moment you are diagnosed with COVID.
But that is not the case here in the UK. It's all nice guided guidelines that we follow. Unless you have got saturation less than 94, you don't come to the hospital. You just manage like a normal flu at home. But coming back to your question, yes, majority of the people who are getting admitted have got similar symptoms of flu-like symptoms, cough, cold, high fever, persistent cough. Those are the symptoms that we are still seeing in this new wave as well.
All right. Professor Roy, even if people are willy-nilly, forced into a herd immunity sort of situation in the United Kingdom now, is there any guarantee that these vaccines will protect against a future mutant which might come to the United Kingdom from elsewhere?
I think that we will have a situation that very rarely will have a variant which become completely resistant to vaccine. So I don't think, so far there is no proof yet. All the vaccine more or less, all the variant more or less worked. The vaccine can protect them. So I don't think that will happen because a lot of the variant will happen. They will cause no special disease for that or more dangerous. It doesn't happen because virus will not survive in a body. They don't like that anyway. Viruses like to accommodate the cell system. So that may not happen. We don't have to worry so much. So what is important, we must be vaccinated. Everybody must be vaccinated.
Okay. Professor Sanjeev Krishna, one last word to you. Just in terms of the booster dose, because there is a sense now that at some stage there is a booster dose which might be required, number one, because immunity could fade over a period of time, and number two, would it perhaps make sense for a booster dose to include protection against Delta and other variants based on what we've learned so far? And if so, when ideally should these be ready?
Great question, Vishnu, because this virus continues to surprise us. And, I come back to the point I made earlier. Not all vaccines are the same. So the answer that I give about booster dose, may not apply across the board. We know the mRNA vaccines give very strong immunity, and they may give longer lasting immunity than some of the others. And some virus strains are escaping from, for example, the AZ vaccine. Now, there is research going on at great pace, and we're coming to the stage where we are understanding the structure of the virus and where the virus may not be able to change so much so that you can get a vaccine that can work across strains, a pan-strain vaccine. So that's a kind of medium-term goal. But in the meantime, it may be important to tweak the vaccines to put in Delta or Delta Plus and give a boost. And this really will depend on how things are being studied in the next few weeks and months, so that we can have confidence about the risks and the benefits.
All right. Well, I'd like to thank you all very much for being with us. What the United Kingdom is doing now is it's a test case perhaps for several other countries. One would only hope that the vaccines do work in saving lives. We'll take a short break, more coming up. Welcome back. Well, in a bid to greatly increase the immunization coverage in Jammu and Kashmir, certainly bring more women into the fold, health authorities in Jammu and Kashmir have redefined what their priority areas are. One of them clearly to ensure that more women are present. Some of these efforts have been very productive. We have this report.
A pink booth to bridge gender gap in the vaccination drive in Jammu and Kashmir. The first exclusive center for women is making a difference in Udhampur district. Sabi Sharma says after establishment of pink vaccination booth, women are feeling more comfortable and easier to get a jab.
आज मैंने यहाँ अपनी वैक्सीनेशन फर्स्ट डोज करवाई है। पहले फीमेल्स के मन में थोड़ी हिचकिचाहट थी कि हम अकेले जाएंगे, रश होगा, बहुत टाइम लग जाएगा, लेकिन मैं उनको बताना चाहती हूँ कि एक्सक्लूसिवली फॉर वुमेन है, यहाँ पे ज़्यादा टाइम नहीं लगता है।
The woman behind the initiative is District Magistrate Udhampur, Indu Chib. She says being a female, she understands challenges a woman had to face while going for vaccination. The move is helping to overcome vaccine hesitancy among women. J&K has administered more than 57 lakh vaccine doses to people above the age group of 18 and 45 years. But women makes only 42% of it.
औरतों को हम देखते थे, उनको बच्चों के साथ या प्रेगनेंसी में या परेशानी में बहुत दिक्कत होती थी, बैठना उठना मुश्किल होता था. And secondly, being a female, I understand that going for a vaccination means a lot. Because वहाँ जाके भी अगर आपको परेशानी का सामना करना पड़े तो फिर बड़ी दिक्कत होती है. ये सब चीज़ें सोच के हमारी एक टीम की ऑफिसर ने हमें सजेस्ट किया कि मैम हम अलग से बूथ बनाते हैं औरतों के लिए. और she is also a female officer.
Jammu and Kashmir was first place in the country where door-to-door vaccination campaign was started in border block of Bonyar in Baramulla district. Starting pink booth for vaccination is another major initiative to bridge the gender disparity. Udhampur is showing the way. Pink booth is expected to fast-track vaccination for women in Jammu and Kashmir to bridge the gender gap. But all will depend on availability and uninterrupted vaccine supply. In Srinagar, Nazir Masoodi for NDTV.
Well, we continue to focus very, very closely on the entire vaccination effort in India and around the world on this program. It's a special partnership that NDTV has with Google, Vaccinate India. It is so important because the battle against COVID is far from over, and remember, there is serious discussion on the possibility of a third wave. That is what India does not want. So please do vaccinate for yourselves and those you love.